New Age Parenting, presented by Neelkant IVF Hospitals. We have the experience. Powered by Psychorian Matrimonial. Ek Rishta Vishwas Ka.
Hello and a very warm welcome to New Age Parenting, and thank you so much. We've received tremendous response for the last episode. Yes, a lot of emails and a lot of phone calls. We can understand that this is your platform and you really want a lot of more information. For that, we would be having Dr. Bindu Garg once again for these 2 episodes. So let's move over to Soul Searching. In our Soul Searching segment, as promised, today once again we have Dr. Bindu Garg, infertility expert from Neelkant Hospital. A very warm welcome to you, ma'am. And thank you so much for taking our time. Last episode, so many people have called. We've received so many emails and people have been thanking you. We've always talked about, that of course the physical problems which are there. But how about the emotional blocks? You said last time counseling plays a very important role. What kind of counseling is there and what kind of emotional blockages most of the people have?
See, the very interesting case, we got a call after this episode. My counselor got a call. Madam, I was sitting at home and with no hopes now, and I had given up all the hopes of going. I didn't want to go to a doctor, but after listening the program, now somehow I am feeling that I should again go. So she has taken an appointment. So this is exactly how you feel, that you should not create a negative aspect into the lives. That see, we can't do, you can't do 100%, but still counseling them and just counseling that try again. Don't lose heart, but till the doctor tells you yes, that see, ultimately you have to draw a line, and we have to make them realize that it's high time they should stop going to a doctor, because that's also a trauma.
Going to a gynecologist, yeah.
Every time getting up in the morning, and the very fact now today again the you have to, even the taking a chutti from the office, then making the whole schedule, changing the whole, that's also very traumatizing.
So what is the time where we should realize that we have to meet an infertility expert? What should be that time?
See, there is no particular time, but yes, you should know the problem. That if my problem needs an immediate treatment and needs an expert treatment, then yes, earlier the better.
Once they've started the process, suppose of this, they've gone to the infertility expert and they've been trying, because then they become quite impatient.
Yes.
Because they've already gone through a lot. There is social stigma, there is emotional upheaval, and there I think some hormonal problems also must be there. That is why they're not able to conceive, and a lot of that kind of trauma is going through. And then they want miracles to happen.
You can't do miracles, but yes, we start investigating them in an ethical and in a proper protocoled fashion. Like, suppose we always test the males first, just to realize, yes, always a semen analysis. I do first the male partner evaluation, just to rule out that the semen is normal on the male part. Once we rule out that, then we do the set of investigations on the females, and the basics are, we do a day 2, second day or day 3 the blood test to know what is the hormonal evaluation of the patient. Then we check the tubes, which is normally done with a it is called an hysterosalpingograph. It's just an X-ray which is done maybe under local anesthesia or maybe under general anesthesia. We give an injection ketamine if it is very painful, and then we do an X-ray to check the tubes. If the tubes are normal, if the hormones are normal, then we don't rush to IVF immediately. There are simple process like intrauterine inseminations, and suppose the fault comes with the tubes, then we try to open the tubes. So what the investigations tell us, according to that we take a decision about what is to be done next.
Another thing which I wanted to ask is that even if it's the male who has a problem or the female, even if the fallopian tubes are blocked or the the quality of the sperm is not that good, is it a disease?
It's never a disease. It is just that you are having a problem. The disease, you can't call it as a disease. The things is that
these are the mindsets which are there in people.
It's not a disease, but yes, you have infections. You can call it as a disease or you can call it as a problem, but solvable problem.
And what are the reasons for this? Do you have the reasons for this? Is also a lot of
Yes,
emails we've got that blockage of the fallopian tube.
Blockage,
Is
yes.
it there is some some upbringing fault, somewhere they have made a mistake, or something genetic is there?
The main thing is the infections. In India, the main infections is tuberculosis. Tuberculosis, but if detected at an earlier stage, and if the tubes are, if you give the anti-tubercular treatment, sometimes these tubes, they start functioning. But if the disease is so prolonged, and the side effects of the tubercular bacteria on the tubes are there, then they get blocked. And then there is a condition which is called as hydrosalpinx, when the tubes get blocked and then they get dilated. That is, if the females has reached to that stage, then you can't do something. Then
and
you
that
can't do
also is the
anything.
reason.
That is the main reason.
Tuberculosis.
Yes, and other reasons are the normal infections, poor hygiene, use of all these contraceptive devices. Sometimes you must have heard that they didn't have any problem in conceiving the first child, but the second time, no, they are not able to conceive. And if you take a history, there's history of intrauterine devices just for a contraception. Sometimes they also cause, but main is the infections. Now infections can travel from many places. Sometimes there is no cause.
When there are 2 or 3 abortions,
yes,
then the pregnancy, again becomes a very major problem.
Yes. And the major problem that comes is with the lining of the uterus. Suppose they say that we got it done over there and then we have a problem. So they blame sometimes the doctor. The doctor did it. We always tell them it is not the doctor, it is the side effect of a procedure. So if you don't want a baby, use contraceptions instead of having a pregnancy and then getting it aborted. So you should space your children, but not resort to the abortion because it's an early or it's an unplanned pregnancy, because sometimes these abortions, they cause infertility.
Mother has a tendency of abortions. So do you work on the abortion part first, why the abortions are happening?
Yes, exactly. And this is called as a bad obstetric history, and there is a complete set of investigations. We call it as a BOH panel. We test everything because we don't want that once you treat the patient and then she aborts. So we go for all the tests, that if anybody is having, they can always contact any of the doctors, and once we feel that next time that yes, she is a fit case, now she should go for a pregnancy, then we advise her.
And how about the male infertility? What are the reasons for that?
Male infertility, see, there are 2 things. Either the sperms are not there, or if they are there, they are less. If the sperms are not there, that's entirely a different book, and it's an entirely a different, the different chapter. But if the sperms are less, the common faults, which is the lifestyle, smoking, alcohol, other stress factor plays a role. These environmental conditions, they play a role. Occupational hazards. Suppose you are working in a place where there's a lot of heat, wearing tight pants, wearing tight clothes, some operations, injuries. So there are fevers, high-grade fevers, sometimes they cause this male infertility. But again, it's not a disease, it's a treatable condition depending upon the cause.
It's only a condition.
It's only a condition,
which can be treated, or at times may not be treated.
And we have now the latest so many methods. Even if the sperms are less, they can always resort to IVF.
What is the reason for no sperms?
No sperms, say viral infections in the childhood, mumps, and the history of there's a condition called as undescended testes in the childhood, when the testes are there in the abdomen and it is undetected. So by the time you replace them at their usual position, the sperms are already, the germ cells which make the sperms, they become dead. But main is the mumps, virals, and then there's a genetic defect. If you test them academically, there is a fault, genetic defect in somewhere in the gene, Y genes.
Dr. Bindu, in soul searching, we've really realized, there are a lot of things which, a lot of thoughts about this whole process. And of course, one, there is hope. But one, there were a lot of these questions, which people had. And we've been receiving a lot of calls. So time now to actually move over to Mythbusters. In Mythbusters, once again, we have the privilege to have Dr. Bindu Garg, who is an infertility expert in Neelkant Hospital. Dr. Garg, we have received so many mails, but this mail I really wanted. He's not written his name, but he says that he's been a juvenile diabetic and he's been now married for last 10-12 years. He has got one child, and that was normal. He says that was normal because in the beginning only we had this baby. But when we tried for the second baby and we realized that it was not happening, the wife was not able to conceive. And then there was, because of being a diabetic, in fact he has been a diabetic now for the last 30 years, is that there's not that much urge is there, and impotency definitely plays a major role. And he wants to ask is there that my manhood reduces? Another lot of people have this very subtle questions, that if my sperm count is less, if I don't have sperms the way like we were talking about, does it really mean that I'm not a man anymore?
No.
I mean,
it's a big myth. But see, manhood, what is the parameter? So you can't define that this is manhood. The sperms count, motility, and a manhood, according to me, they are two different things. You don't lose your manhood, but see, since he's a diabetic, so diabetes is one disease which causes, if it is uncontrolled, which causes all these problems. So basically he should be in regular touch with his endocrinologist, who will guide him the actual treatment. These people are already on insulins. Maybe his doses are changed, so he should go to the doctor and see if his diabetes is controlled or not. He's already got a child, so we don't expect the sperms to become nil. If the sperms are not nil, then he should get the wife also checked up. Maybe some problem has occurred in her also. So basically we check the tubes and her hormones also. If we find both of them normal but the sperms count are less, then there are other methods they should resort to.
Another myth which a lot of people have asked us is that the child who is born through these procedures, is he a normal child? Because because people have this misconception that will he have some problems, will he be detached because he'll not be a love child, he hasn't come, even if it's our sperm, our egg, it's not the love child, so will he be detached from us? Will the mother not be able to take care of the child?
I think it's the opposite. Since it's a truly blessed, and after so much of efforts, so that child is a more precious and more cared in the not that other childs are not being cared, but it's the other way around. Once the child is born, it's never, no couple, if you ask them, they never feel it's an IVF child, or it's even through a donor or even through a surrogate, because the whole family environment changes. I feel it's the opposite. They become more close to each other because they spend more time with each other once the child is there. And you must have seen the husbands, they're coming from the office. They don't spend so much of times working hours, because then you have an incentive to go back to the house and play with the child.
Yes.
I feel it's the other way around.
And they've really made a lot of efforts to create that child actually.
And there is another what the old women say, that once the child is born like this, sometimes they conceive on their own. And so many instances they adopt a child, and after 3-4 months only the couple conceives. It is because that stress is gone. They feel more happy, they are together. I mean, they spend more quality time with each other, and the natural conception happens.
And this has also happened.
Yes.
That one first child can be the
after the adoption, after IVF, after that there can be many times a natural conception. We have seen so many cases.
Very true. A lot of myths getting actually solved on this platform. Dr. Bindu, at this juncture, we'll take a short break, but we'll be back soon with Mapping the Conflict. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh. Welcome back to New Age Parenting, and today in Mapping the Conflict, we'll try to find out that what were the myths, and yes, we have the answers, but what are these procedures which can really help couples? And for that, once again, we have Dr. Bindu Garg, infertility expert from Neelkant Hospital. A very warm welcome once again. Now, people have been wanting to ask is that what are these procedures which we talked last time, but in detail, because connected with those procedures, people have a lot of questions. So you talked about laparoscopic procedures, you talked about IUI. So can we talk more about that?
See, the laparoscopy, I told you, the indications, the main indication is when there is a tubal block. But the success of the laparoscopy, the tubes getting opened after the laparoscopy is not very lucrative. 20% yes, but it depends upon where the block is, at what time the disease process is in advance, and what is the condition of the tubes.
But what happens? How do they get blocked? What is it that blocks them?
Blocks is the fibrous tissue. Once the infection is there and when it heals, there is a fibrous tissue which forms inside, and then it blocks the tube. Now, if there is a connual block at the start of the tubes, there is a guide wire. We put it and we open the connual. It's called as a tubal cannulation, the tubal connual cannulation. And if the block is in between, then yes, then there's no point trying, because then you have to cut the tube and re-suture it, which I will never advise as a first line procedure, because there are better options than this. But if the block is in the end, that also we can try, but we never, after the laparoscopy procedure, any time that you feel that the tubes are not in a good condition, sometimes it can land up into ectopic pregnancy later on when the patient conceives. So tubal cannulation, yes, it has to be you have to judge it, that what are the chances that the tube will get opened, and once it opens, the patient conceives in a natural way. So one indication is that. Another indication which we are mainly doing is for the PCOS. Now the hairy women, obese women, married for 7 years, more than 30. So there is a procedure where we drill these ovaries, which is called as a Leo's operation, ovarian drilling. Again, there are very side effects. Some say it should not be done, some say it should be done. But yes, if given 5 to 6 punctures in that ovary, it is worth trying.
What really is done in that?
We drill these ovaries and then they start ovulating. The hormonal milieu after the Leo's operation becomes in such a way that they start ovulating.
But this is again a laparoscopic procedure?
Laparoscopic procedure, never open the abdomen. Then there is a condition called as endometriosis. Okay. Then we remove these endometriotic spots and we clear the ovaries, we clear the pelvic. So it's basically a restoring surgery for the pelvic organs, and done a good laparoscopy by a good surgeon without traumatizing the organs. The success is very good, and again depending upon the cause. Post endometriosis, and for endometriosis, this laparoscopy does wonders. Done at a proper age, with proper surgeon, with proper the washing of all the pelvic area, the results are very good. But once we feel that after the laparoscopy also the patient is not conceiving, then there is a procedure which is called as intrauterine inseminations. Now indications for this are again many, but mainly it works if there is a subtle, not a severe male infertility. Suppose the counts are, normally they say the counts should be more than 20 to 40. Previously they used to say it should be more than 60. But now the WHO standards, if it is more than 20 and the motility more than 40, even then this sperm can work for intrauterine inseminations. Now what we do is we induce the egg formation in the women, and when the egg matures, we do the serial ultrasound studies. We don't call the patient every day. Now once 2-3 examinations on ultrasound will give us an idea about when the egg will mature. Once the egg matures, we give them a trigger for the ovulation. And then 36 hours later, we take the husband's sample, we call them in the morning, husband gives the sample, go back to the office. After 2 hours, we call the women, the wife, and we wash the sperms. So all the good quality sperms, we inseminate. The chances again become more, 20%, because 20% more than the normal, because you are inseminating the good quality sperms inside the uterus. So they are very near the tubes where the egg has ovulated. The egg, after the ovulation, the egg reaches the tubes, the sperms are very near to the tubes, so again the success is better. This is a condition where it works. And sometimes unexplained infertility also, because we don't know actually what is happening to the sperm. So we make it sure that the sperms are there in the uterus. So this is called as intrauterine inseminations. But again, we don't go for many cycles, we go for 3, 4, maximum 5, but this is not a procedure which is to be embarked upon, that continue IUIs. Once this is also a failure, then yes, then that is the suggestion. Again, we counsel the patient that go for an IVF now.
And is it too expensive? There's
not
another myth.
Not at all. Laparoscopy is like any other surgery now, and there are so many now training centers, so doctors are well trained for it. So this is also not a very expensive.
And is it a painful procedure?
No, all done under anesthesia. Laparoscopy is done under anesthesia, but intrauterine inseminations is a local. No anesthesia is required.
Dr. Bindu Garg, thank you so much for taking out time and being with us. In fact, we really need to understand that these new age kids who are raring to come and who really have a lot of work to do are coming, even if nature, the way Dr. Garg said, that nature is also at times blocking it, but they're passing through the nature and creating another means to reach out to this world. We really need to actually get up now and take care of these new age kids, because parenting is a little different for these new age kids, but then it's very, very innovative and it can be very, very creative. So till the time we meet again, enjoy parenting. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh.
New Age Parenting, presented by Neelkant IVF Hospitals. We have the experience. Powered by Psychorin Matrimonial. Ek Rishta Vishwas Ka.